Hi guys, welcome back to my channel. My name is Christian Nicole, and if you're new to my channel, please like, comment, subscribe, watch a few other videos. I have just gotten off of work and we're gonna have a little bit of a conversation on my way home. It is about 5:13, so I'm about to hit 5 o'clock traffic in Orlando, which is typically awful. My drive home will be around an hour and a half, 2 hours. I will not hold you guys on YouTube that long, but yeah. So I wanted to address one of the questions that I was asked by I'm not sure if it's a subscriber or not, but a person on YouTube asked, what's one of the most difficult things that I experienced as a new nurse practitioner? So I would say that most difficult thing is prescribing. I work in pediatrics, so it's not even the pediatric dosing that, in RN programs you're typically like really nervous about. It's not that. Pediatric dosing is really easy to me. It's the same thing over and over, which is milligram per kilogram, and you have to find out the patient's kilograms and do multiplication. So that's super duper easy. It is trying to figure out which medication I'm going to prescribe, because sometimes the same condition requires different medications. For example, a rash or a UTI. And what I would treat a patient with a UTI is not necessarily what the physician that I work with would use. Now, one of the best things that you can do when prescribing, especially antibiotics, is send cultures. So if a patient has an upper respiratory infection, you suspect an upper respiratory infection, and especially in pediatrics, I like to send, which I have learned from the physician that I work with, I like to send upper respiratory panels to the lab because I want to see what's growing. Now, we know that most upper respiratory infections are viral, and you're not going to prescribe an antibiotic for that, but you may find that this patient has MRSA, or this patient does have bacteria in there, or if it is RSV and the patient is super duper young, like a baby, then you'll be concerned. So you want to send all the swabs that you can send. If it's a skin infection, if it has any type of moisture to it, send a swab, because then you'll know really how to treat this specific patient for this specific condition. So it is a little bit difficult trying to figure out what's best, and especially for kids and working in pediatrics, you have a lot of babies that spit up, and as soon as they spit up, mama or daddy, usually mama, wants to change the formula. Well, there's only so many formulas on the market, so it's like, what in the world do I do? What do I do? So I find that to be a little difficult. And at what point do you say, okay, I don't need to prescribe another formula, I'm going to prescribe a medication? Usually we would do ranitidine, but ranitidine was recalled not too long ago, so now it's like, what do you do? So those are my problems with being a new nurse practitioner. Like, what do I order? You literally can order, even for like GERD, reflux, because I do see some adult patients, there's 2 or 3 different things you can order for that. So it's really kind of figuring out what to order. So I think that, yeah, that's my most difficult the difficult part of being a new nurse practitioner. I don't think that, I thought it was going to be lab interpretation. I don't really think lab interpretation is that difficult, because I order basically the same type of labs. I'm working in this specific area in pediatrics, so there's not a lot of labs being ordered, but when I do order a lab, I pretty much know what I'm looking for, because it's the same thing I've been ordering for months and months already. So I wouldn't even say that would be very difficult. So what I planned on doing actually was revisiting my notes and study videos from my nurse practitioner program, all concerning prescribing antibiotics, and just kind of seeing if that will help me, because I swear to God, this doctor I work with is so, I tell her all the time, her brain is like an encyclopedia. She just knows exactly. I'm waiting at the gas station. She just knows exactly what to order, and it's so crazy. It's so crazy. She knows this specific, the demographics for our office. So, I mean, her brain is crazy. How she remembers what will treat what. And I feel like I knew it when I was in the program. I knew it to pass my test. But now it's like, okay, I have to re-study that again. I find myself researching a lot. And I do it pretty quickly, so I don't waste much time researching, but I do find myself researching. But this is the thing about doing research. You can find an article from within the last 5 years, let's say 2017, and then you can find another article, different article in 2019 that's telling you to do something a little different. It's like, which one do I follow? And the thing that I had to tell myself is neither one of them are necessarily wrong, but it's what is good for this particular patient at this particular time, and just kind of go with that. And another thing is, working with a physician, you may find that they want you to do things the way that they do things, prescribe the way that they prescribe. And I've had this conversation with my supervising physician, who I feel is, she's really, really nice, and she teaches me so much. But I did have to tell her, like, I am not a carbon copy of you. If we may have two different ways to treat the same problem, and neither one of them are wrong, like, dude, it's okay for me to do it this way. And she understood, she agreed, but she also knows these patients. She knows these patients since they were born. So I kind of listened to her too and give in a little bit. So yeah, that is it is something else trying to prescribe. And I'm going to tell you guys, the first time I called in a prescription to the pharmacy, I literally asked the person on the phone, okay, what kind of information are you expecting from me? Because I know how to write a script, because I was taught in school how to write a script. But I wasn't taught how to call in a medication, which is weird, because you would think that you would just know that. And I mean, the first time I called, it was a pharmacy tech, and she was actually pretty rude, and I had to snap back just a little bit. But yeah, so it was so weird to just call in a prescription. We had an episode where I had to, like, I usually send medications electronically, but we had an episode where the internet was just not acting right. So I had to call in handwrite most of my prescriptions. And I was like, wait a minute, what do I put on this paper? Because I had gotten so used to prescribing electronically. So I was like, let me make sure I just put everything on here that's supposed to be on here. Otherwise, this is not going to go through, and I'm going to look like a whole fool. So yeah, I think it's important to revisit your notes, especially as a new nurse practitioner. Revisit your notes, whatever your weekend. You there may be somebody who is really good at the medications and really good at prescribing. Me personally, it's just so much. It's so many options out there that it's like, I don't know. I just feel like I don't want to do the wrong thing. So I am like, Hippocrates is my best friend. I have Hippocrates on my computer. When I get to work, I pull up, a window with Hippocrates, and then I have the Hippocrates app on my phone. Hippocrates is kind of expensive annually, but I paid for it because I was like, I need this. I also use EMRA, the app, EMRA, which is like Emergency Medicine Residents Association, something like that. They have a really good antibiotic app, which I use that too, and I find that it is like 99% the same as Hippocrates. So I'll open either one of those. I did know this and up to date, but I did, pay for the up-to-date subscription, which is like monthly, which is like $60 something a month, which is kind of expensive for just this little app. And I really think it's, Lord, I don't want to bash Up-to-Date, but it's not worth it. Up-to-Date has so much information that I don't even have time. Like, if I research something like, I don't know, hip pain in kids or something, it's like a Google search. So much comes up, then you got to figure out which article what do I want to click on, and it's such an abundance of information. It's like, I just want to get to the point. I want to get to the point, and I feel like Hippocrates really gets to the point. So I don't have time while I'm at work to go through everything that's on Up-to-Date. I still have the subscription. I don't know if I'm gonna keep it, but you know, I haven't really found it that useful yet. Not for me as a new nurse practitioner. I would not recommend paying. It is really expensive. Annually it's hundreds of dollars. Monthly it's like $67, I think, something like that. I don't really think Up-to-Date is necessarily worth it. So Hippocrates, Emmer, those are my best friends. That's what I use, because I feel like prescribing, I'm not really that confident yet. I don't think I've messed up prescribing, or the doctor would tell me, she would tell me, but I just don't really feel confident in it. So I will see how it goes. We'll see. But anyway, I just want to touch bases with you guys. I was supposed to start my Vlogmas yesterday. Today is the 2nd of December, so yeah, that did not happen. So today is day 2 of Vlogmas. Day 1 for me. We're just gonna skip on over day 1, December 1st, and try to continue on from here on in. So I have another video for you guys hopefully tomorrow. I think I recorded tonight because I have to write a paper, and I really wanted to go over APA format with you guys. So probably gonna go ahead and record that so we can discuss APA format. I know this like a bane in our in our existence as nursing students, so I want to try to make it easier if I can. I will get back with you guys later. Don't forget to like, comment, subscribe, and thank you so much for watching my channel, and thank you so much for all of the new subbies that I have. I hope you actually click the notification bell so you'll be notified when a new video uploads. Talk to you later. Bye.